Hi, I'm Kudzai Kanhutu. I'm an infectious diseases physician at Royal Melbourne Hospital. So I became a specialist, in particular infectious diseases specialist, because it really aligned with the things that I enjoyed doing outside of work and before embarking on a career in medicine. So if you do physician training, you certainly get a lot of opportunity to study history, politics, economics, geography, and all of those other, maybe not strictly medical things. So physician training was really a process of exclusion, trying out things and deciding no, they didn't really work for me, and then landing on the right sort of personality fit. I would say my most valuable skill from a clinical perspective is actually the experiences I've had outside of work. So having worked in other industries, having had, quite a diverse upbringing and migrant experiences has really allowed me to connect with people on multiple levels rather than coming at it from a purely clinical perspective or a medical view. I would say the biggest influence was the relatives and the family that I grew up with and around. So I had an auntie in particular, Auntie Connie, who was a midwife and the chief nurse at a prison clinic. So I used to spend summers with her watching her work and just getting that appreciation of the change and the value that you can bring to people's lives through working in the healthcare sector. And I think she was really central to my aspirations to become a doctor in the first place. Overcoming that challenge of not having a job to just walk into really makes you question and think hard about what would you be prepared to do. And for me, I always had a really strong social justice angle. So then I thought, well, actually infectious diseases, you can do refugee health, you can do migrant health, you can do lots of community-based health projects and programs, even Indigenous health. So it was then starting to think, what can I marry up my infectious diseases skills with, rather than thinking I just have to find a single, unifying job that is pure infectious diseases. Part of it is thinking, okay, what are the things that I've learnt that have gotten me to this, pointy end of getting my final letters and saying I'm a fellow of the College of Physicians. And infectious diseases is incredibly holistic. So you have to be thinking about the individual, about the community, about the political context, about a whole host of things in order to come up with a plan. So it was easy in a sense because I thought, okay, so what are the big changes that are converging in society at the moment? We've got digitisation and implications of that on infectious diseases management and new diagnostics. So it was about picking through all of those converging forces and thinking, okay, IT, digital, that's always going to be relevant. Infectious diseases, always going to be relevant. Now pick amongst those things and choose how you're actually going to upskill in those parallel but complementary sort of skills pathways. The Refugee and Migrant Women's Health Initiative, which I participated in as a representative of the college, I felt was a really impactful project to be involved in. So it involved us working with members of the other training colleges, so midwifery, nursing, anaesthesia, surgeons, a whole host of other colleges, in order to arrive at essentially a framework for how to deliver better care for refugee and migrant women in Australia, acknowledging the profound challenges that they often have in achieving equitable health outcomes. And the beautiful thing with that piece of work is that I've seen that same piece of work referenced within the community that I work in, people actually saying, hey, look, we've come across these guidelines, this framework, and we found it really helpful in terms of giving meaningful, achievable change within the workspace that they're in. I would say don't walk anyone else's path. It's more about finding your own and feeling comfortable in your own footsteps rather than trying to copycat or mimic. Of course, take inspiration, but remember that at the end of it, it needs to be a decision and a pathway that you feel comfortable with and that actually resonates with your own experience and your own goals. I'm really proud of having established the telemedicine unit at Royal Melbourne Hospital, which I did at a time when nobody really was that engaged or enthused about telehealth, so long before COVID. And I've always felt that it's a real achievement if you can bring people on board at a time when there isn't a pressing urgency or a need, and get to a point where people can already start to see the value of something. And that's only become even more apparent post-COVID. I would hope my legacy would be that I can empower other people, regardless of the professional sphere that they come from, to achieve impact without having to feel like they have to apologise or they have to try and mimic someone else's previous achievements, simply that they have a desire to change something that they see that doesn't sit right with them, and that they can go for it unapologetically and do what their heart desires.